in Indianapolis to examine the impact the opioid epidemic is having on mothers and babies.
Fitting time for it. This is the day that we're devoting an entire day on Wish TV and WishTV.com to stories about the opioid crisis, the epidemic's impact on the state. Brittany Lewis joins us now. You look specifically at issues of pregnancy, moms, babies, and how the opioid epidemic affects all of this.
Yeah, and I talked to a doctor at IU Health who is working with these mothers and who's very passionate about it. Her name is Dr. Tara Benjamin. She told me when a pregnant woman is misusing opioids, the dangers to her baby are mainly the dangers in the environment. If she gets HIV or hepatitis C, if she overdoses or experiences domestic violence. Half of babies who are born to a woman who has been misusing the drugs experiences something called neonatal abstinence syndrome. That's when a baby withdraws. They are treated for that, but she says the moms are the least, the last, and the lost of the opioid epidemic because it's hard for addicted pregnant women to find care. That's something she and others who know what it's like to have a loved one battle addiction are working to change.
I've had them.
Raylene Hobbs has worked as a nurse for kids and babies' moms
Labor and delivery
for more than 20 years.
I love taking care of the babies, but my favorite part is taking care of the pregnant moms.
But it was only in the last year
I just knew this is where I needed to be.
where she found the moms who needed her most.
I would really, sorry, it's emotional.
Those emotions come from a mom who has had the most unwanted kind of knock at her door.
So it was a police officer, and they had said that my son was found down at a hotel and that he was on a ventilator and he had been there for 18 hours.
An overdose.
You know, for a mom, the way to the hospital, the thoughts that went through my mind are, you know, how are we gonna bury him and what am I gonna put him in? And
32 days later, her son was out of the hospital. 3 years later, he's clean, and Raylene is working with pregnant moms dealing with an addiction of their own.
when my patients come in and they're here for opiate, one of the very first things I tell them is, I get it. And I've been there, and I've been that mom, and I'm proud of you.
Those patients are part of a program that was started a few years ago to help pregnant women with opioid use disorder.
We started to see these patients out of necessity. They started to show up because they needed care.
Dr. Tara Benjamin is the director of the maternal recovery program for Riley Hospital for Children.
When I started taking care of these women, I started to get mad because there's social injustice surrounding their care. Actually, anybody with a substance use disorder, there's social injustice surrounding their care. And the madder I got, the more I wanted to help them fight this social injustice, because they have a disease that's just like diabetes, a disease that's just like high blood pressure or hypertension, but they aren't treated the same way.
She says since 2015, they've treated around 330 women. At any given time, she will be treating around 60 women, both pregnant and postpartum. The women in the program are given buprenorphine, a long-acting opioid that is used to help opioid and heroin addiction, and they undergo counseling.
Help to ensure that they have a healthy, happy pregnancy, healthy, happy babies, and make sure that they're transitioned to postpartum care appropriately.
A program that includes a nurse who has been there.
And I just tell them, you know, one day at a time, you can do this.
Giving women a chance to be the best moms they can be.
So as part of the therapy, these women go through group therapy, so they meet with the other moms who have also been addicted and who have been pregnant. So it they talk about going through pregnancy and also their addiction, so they really hope to empower them so that they can really be the best moms they can be to both care for themselves and their babies.
After pregnancy, though, or after birth, I should say, how long do they get care, and what if they need more care?
Yeah, so IU Health works with different agencies to kind of set them up with the best care that they need. And Dr. Benjamin herself works with many of the women much longer after she really needs to see them. She's very passionate about this, and she told me she gets more passionate after she hears their stories, and she said that if she had gone through what some of these women have gone through, she may be using herself as well.
Wow. And how do people even find this? If a woman is in trouble and they need this, how do they get involved?
Yeah, so we'll get information about the specific program on WishTV.com, but a lot of times they get referrals.
Okay.
Or sometimes women just end up hearing about this program.
Wow.
This is a story that more people need to see than maybe just sitting at home right now watching. As we get that up on WishTV.com, invite you to share it as well to friends and family that you might think need to see it too. One of several stories you'll see throughout the course of the day as we continue this day-long coverage of the opioid epidemic.
Thank you, Brittany. It's important. It's 9:15.